The San Francisco International Airport is one of 4 major airports in the U.S. where the CDC has really stepped up COVID-19 surveillance in hopes of spotting the variant quickly. So how do health officials determine what variant you have, and does it really matter to the patient? KSHB 41 News reporter Charlie Keegan worked to get those answers.
That's a tradition. We always get the real garland.
REID HILDENBRAND can smell the garland and taste holiday meals.
I love food, and so to have to experience food without taste and smell is like really sad.
In August, the Kansas City man contracted COVID-19, temporarily losing his sense of taste and smell. He knows the vaccine kept him out of the hospital. He doesn't know which strain of COVID infected him.
When I got tested, I asked, hey, is it possible for me to know this is a Delta variant? Is that something I'll know in my results or whatever? And she basically told me that they wouldn't be able to know.
COVID-19 vaccine manufacturers hired labs like Viracor right here in Lee's Summit to find out which strains exist in positive COVID-19 samples. That way they can make sure that the vaccine's still effective against those strains.
Sequencing allows the tracking of the emergence of new variants.
Steve KLEIBOEKER said a time-consuming process called sequencing determines what variant is present. In labs similar to Viracor's, Missouri and Kansas's health departments sequence a sample, but not all of the positive test results in their states. That helps guide policies like travel restrictions and mask mandates.
The FDA approved.
KLEIBOEKER's company has gone a step further, developing a test used in Europe that both detects COVID and a particular strain.
It's really a classic screening approach. So you can take many hundreds, thousands of samples and know where to look with your sequencing.
Unless the Omicron variant resists current treatments, doctors say they treat all patients the same, no matter the variant, which is why HILDENBRAND never found out which variant infected him.
We all still have to take this thing seriously, be careful.
Now fully recovered, he's hopeful for brighter days. Charlie Keegan, KSHB 41 News.